All right, everybody. Well, thank you so much for joining us today at our March HICP meeting. We're going to go ahead and get started. Before we do, we want to make a few announcements. Please, first and foremost, mute your microphone unless you are speaking. We love if you are able to enable your camera so we can see each other as we share the space together. We also have our meeting translated into Spanish, so please click on the interpretation button at the bottom of your screen so that you are able to select the language of your choice. And please do note that this meeting is being recorded. Juliana, do you want to join me by sharing all of that in Spanish as well?
Absolutely. Good morning, everyone. Sorry. Buenos días a todos. Bienvenidos a la reunión.
Good morning to everyone. Welcome to the meeting. To have a better experience during the meeting, please mute your microphone unless you're speaking. Enable your camera.
Y si usted quiere, y si por favor puede seleccionar en estos momentos su idioma de preferencia haciendo clic en el botón de interpretación, ya sea en inglés o en español. Tenga en cuenta que esta reunión está siendo grabada. Back to you, Heather.
Thank you so much, Juliana. All right, let's go ahead and get started. So it is indeed March. The year seems to be flying by. I'm not sure how that's happening, but here we are, March 4th, ready to get started. As we just mentioned, this meeting is being recorded. We do want it to be interactive as possible. So we certainly hope that you're able to, raise a hand if you have a question, and we'll call upon you at the right moments. You're also always welcome and invited to enter comments and questions into the chat. And of course, please do select the language of your choice so that you can enjoy and participate in this meeting fully. Before we get started, I'm going to go ahead and read off our guiding principles that were designed together during our first meetings back in 2017. All participants agreed to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agreed to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. So here's a quick look at our agenda for the day. As always, a full meeting which sits ahead of us. We're delighted to kick our meeting off with, as always, an update from our LAC USC Medical Center. Then we're going to quickly do a new member welcome to welcome some new members to our space. We'll have an update on our General Hospital and West Campus feasibility study. We'll have an update on some campus projects. We'll have a presentation on healthy homes and a presentation on transportation updates. And we'll conclude with an inclusionary zoning update from the Department of Regional Planning. With that, we'll go ahead and kick things off. I'm delighted to welcome Edgar Solis to share with us some updates from the LAC USC Medical Center. And I know Edgar would be delighted to take your questions, so please get those ready for Edgar.
Good morning. Buenos días a todos. And thank you for allowing me to provide this update this morning. The medical center is doing very well as compared to the last couple months. It seems that we're at the tail end of the latest surge. In fact, I think we're seeing levels in terms of COVID similar to those that we saw, in early fall. In the last 2 weeks, we really haven't admitted a patient for COVID disease. We currently have 56 total patients hospitalized here in the medical center. 18 of which are in the ICU and 38 in the non-ICU rooms. But they're not here for COVID disease. We still continue to test every patient before they're admitted to our hospital, just so that we can see their status and their COVID disease status. But that doesn't necessarily mean that they're here for COVID disease. And probably here for, heart attacks or a surgery, trauma after an accident, different reasons other than COVID. And so a lot of this is because a lot of people have been vaccinated in the community. And also, community spread was very high during the winter months of December and early January. And so that's when we saw, when we reported during that time of a large increase in admissions related to COVID. But we're happy to be in this situation where we've moved past that, and we're now seeing the tail end and really not admitting disease. Some folks continue to test positive even though they've recovered from COVID. We'll still continue to identify it once we test, but that doesn't necessarily mean that they're contagious or that they're here for COVID disease. We do see some patients that are admitted for COVID disease a few weeks ago, and the majority of those patients were unvaccinated patients. We do see some patients coming in with COVID disease that were vaccinated, but they tend to be mild and don't require hospitalization. So we'll see them in the ER. They don't need to be hospitalized, and they're discharged home. Typically, those patients have other diseases or are immunocompromised that we're seeing a lot of the breakthrough cases. We still continue to see and manage the evolving pandemic, and the best defense for another surge or disease is vaccination. So we continue to provide vaccines in our vaccination clinic that's available to the public and to our workforce. These vaccines are available. We also have the boosters available to our workforce and the public. And those that are 5 years and older, we have that available not only through our primary care clinics, but also our COVID vaccination clinics. We received a couple of questions regarding some of the mandates and how is that going to impact our staffing. Now we have a booster mandate that the state has imposed, which means that every person that is eligible to receive a booster, every staff member that's eligible to receive a booster, that they do so by March 1st. So that was 3 days ago, the deadline to receive a booster. However, there are some criteria. If you're recovering from disease, you have 90 days from the date of positive or the date of clinical diagnosis of COVID disease. You have 90 days to get that booster vaccine. But we're sensitive to our staffing needs, and so we take that to account as well. So as we evolve and develop policy over the booster mandate, we're taking consideration of our staffing needs and how that would impact our ability to deliver care on a timely basis. So that's something that we're currently working through, and as it continues to evolve, we're looking at it closely to ensure that we have a minimum impact to our staffing. And this is on a this is on top of a staffing shortage that we saw during the pandemic, and some of the strategies that we used was working with companies that provide short-term staffing. We reached out to these companies, and they were able to provide and supplement our current staffing with nurses, with respiratory care practitioners, and other disciplines to help enhance our staffing needs here at the medical center. But this really took an impact on our nursing staffing, and our chief nursing officer did a great job in anticipating this need early and working with these companies that provide short-term staffing to supplement our nursing workforce as well. A lot of our nurses, since they're part of the our community as well, during when the community spread of COVID was so high, they were also being affected by that, and that further complicated our ability to staff. However, we fared very well. I think it's a testament to our dedication to our staff, working overtime and coming in on their days off to help support the medical center and our mission, and really our leaders' ability to see that coming and supplement that staffing with creative ideas and also working with our partners in the community.
Nuestro personal ha tenido la creatividad y la razón que se requiere una tercera inyección.
To fight off COVID infection tends to wane after a few months. And, we see that with some of these vaccines that the efficacy and the antibodies in your body tend to wane over time. And so it is important to continue and follow the schedule for vaccine. And it's particularly important for those that receive the initial series, that they receive their booster once eligible. And it depends on what vaccine you received, but that tends to be about 6 months after your initial series. So we still continue to support the idea that one should be boosted after their initial series to ensure that their antibody levels and their ability and efficacy of their body to fight the COVID disease is still effective. Now, we're seeing a lot of changes in terms of the mandates over masking in the county. I believe as of today, the county will only recommend, and I'll leave the details to our public health colleagues, but there are changes in terms of the masking mandate for the public in LA County. And I think for the schools will be on next week on the 12th. But here at the medical center, we still have a mask. We require to anyone coming into our campus will be required to be use a.
Al centro médico. Esa política no ha cambiado en el centro médico y no va a cambiar en el centro médico hasta que nuestros expertos de control de enfermedades infecciosas hagan una evaluación de la necesidad de usarlas. Estamos utilizando o estamos aplicando las normas la Asociación de Control de Enfermedades Infecciosas a nivel federal, y hasta que haya un cambio en esa política, aquí en el centro médico vamos a seguir utilizando las mascarillas. En cuanto a la escasez, y a pesar de la escasez de personal y los impactos del COVID que ha impactado nuestra capacidad de proveer servicios, nuestras clínicas de cuidados primarios y de especialistas siguen estando abiertos y siguen atendiendo a pacientes. Quizás no al mismo nivel que antes de la pandemia, pero sí a un mejor nivel que el último auge que tuvimos del coronavirus.
Backlogs that we continue to see in elective surgeries.
Vamos a seguir viendo algunos atrasos en el número de pacientes que están esperando las operaciones opcionales. Vamos a seguir apoyando las clínicas y doctores para darles acceso a nuestros pacientes para que reciban esos servicios. Por ejemplo, en cuanto a las operaciones, las cirugías, redujimos nuestro número, o sea, reducimos el retraso a la mitad.
I can check mine as well.
I'm so sorry, Edgar. I'm trying to mute, but unfortunately that feature is not available to me right now.
Can
Sophia,
hear
would you
me?
be so
Sorry.
kind as to mute? Yeah.
My computer's frozen. I'm trying to mute.
Oh, thank you, Yvette. I appreciate that.
I also
Okay, well, I don't know what else we can do then.
No worries.
All right, continue, Edgar. So sorry about the interruption.
No worries, man. So yeah, it's a primary goal, and we're doing everything possible to ensure that the backlog doesn't get bigger as a result of short staffing. But like I said, we've diverted a lot of our resources to that.
¿Cómo está Osvaldo? ¿No?
A lot of improvement in our backlogs in the last 6 months. There was a question over the EDIA initiative. And so the medical center has been, we've selected the subcommittee here at LEC USC Medical Center. Throughout DHS, each medical center will have a subcommittee that represents our medical center at a larger DHS committee over the initiative. The new members will be introduced at an upcoming town hall. And Dr. Galley and DHS leadership are working on a structured framework that will be shared with the community next month. So we can bring that back to you to provide a visual representation of what that means and the composition of our subcommittee members, which really represents how diverse we are here at the medical center. We have a representation from all walks of all disciplines and all backgrounds to be a voice for our medical center on how we can improve here.
¿Cómo podemos mejorar aquí en el centro médico?
And that is my update, and I'm happy to take
Es la actualización que tengo para ustedes.
Thank you so much, Edgar. My gosh, what an incredible set of activities and what a comprehensive report back. Really appreciate it. So yeah, we know that there's a turning of the curve on the COVID, and that's just so great to see reflected at the medical center. We certainly hope your incredible team that's worked so hard over these last couple of years gets a little bit of a relief. And of course, we know that there's that ongoing staffing issues that you guys are working actively to address. So do we have questions for Edgar at this time? I think you covered everything very comprehensively. Anything that I was thinking to ask about, you kind of got you got ahead of it. So I think we're all excited about the youth vaccination process and making sure we kind of move forward there. But I think we're all happy to move into the warmer weather season, which in general has those lower transmission rates of a lot of illnesses, including COVID. So yeah, thank you again so much for everything and for coming and joining us today with that great update.
Thank you, and thanks to the community. I appreciate all your support, and we value your feedback. And I just want to let you all know that we do listen, and we take your feedback seriously, and to enact change for the better. So thank you very much.
Yes, thank you guys all. All right, well, with that, I'm super excited to move on in our agenda. Thank you, Edgar, again for that great update. So next up, we're going to give you a brief update on the General Hospital and West Campus feasibility study. So the General Hospital West Campus feasibility study is definitely back in action. We're delighted to report back to you all about our recent community at large meeting that was held on February 17th. The meeting was hosted via Zoom, and we had about 170 participants. It was very exciting. Supervisor Solis recorded a welcome video for us that kind of gave an overview and renewed vision for the study. Now that we're in this kind of final phase of the feasibility study, and we're really trying to accomplish a lot very quickly so that we can move to those next phases, including the RFP phase. We also were delighted to have welcoming remarks from Senator Durazo and Assemblymember Carrillo, and we had a welcome from Jorge Orozco. Then we had a presentation on the study, as well as a county panel of experts talking about housing and various housing projects, both affordable housing, homeless and transitional housing, and permanent supportive housing. So there's a lot of different projects going on the campus and in the surrounding communities, and we wanted to bring forward a group of people to kind of address the questions of the community as it relates to what are the many projects that are happening that can help address our housing crisis and our homelessness crisis. We also had a great representation, as I mentioned, over 170 strong. We welcomed resident leaders from all the local communities. We also had wonderful representation from our local educational institutions, such as Bravo Medical Magnet High School, Roosevelt High School, Wilson High School, Cal State LA, UCLA, and USC. Our labor was in good representation with SEIU Local 721. And then we had quite a rich set of community-based organizations, as well as organizations providing health, mental health, and homeless services. For those of you who participated and joined us that day, thank you so much for coming out. Thank you for your interactive questions and your commentary. It was really delightful to have you join us on the 17th. So through the course of that meeting, we really raised a lot of interesting questions and dialogue around several key issue areas. So we kind of grouped those ideas into this little framework to share back with you. We saw a lot of questions, of course, relating to affordable housing, as that is one of the key considerations of the study, and I know one of the primary concerns from the community that's been raised throughout this process. We also heard a lot from the community about the need for homeless services and support. There were definitely questions about workforce and job opportunities and training programs that might pertain to the future developments on the campus. Also, a lot of interest in accessibility and accessibility needs as they pertain to the campus, ensuring that the campus is accessible to all, that there are greater connectivity points to other parts of the community, and making sure that it is both pedestrian friendly, bike friendly, and safe. And finally, there were several questions about community engagement and input, and what those future phases are going to look like in the study as we move beyond the study process into the RFP, the developer selection, and future phases. So to give a little bit more summary on some of the things we heard from our community at our meeting, I have 3 quotes here that we received. There were quotes / comments that we received through the course of the meeting, and I wanted to share them back with you. The first is, "Hi, my name is Maria Ruiz, and I'm happy and proud to be a part of this community, Boyle Heights. I was at the December 9th session. We were talking about our vision for the General Hospital. My son Eduardo was writing his suggestions, and I'm going to let him know that his voice is heard, and now it's going to be a reality. Like somebody said before, this is our General Hospital. So thank you so much for letting me speak. Thank you for all the work you're doing." We were so honored that Maria Ruiz came back and she saw that some of the comments she and her son had left at our December 9th Community at Large meeting were now being reflected in the study, in the feasibility study reuse model. We received the comments, we incorporated them into the feasibility study, and she saw herself reflected there. That was such just a wonderful kind of tribute to the community engagement process and just how important it is for community voices to come out to speak to advocate for their needs, and then of course to see that feedback loop closed when they see their feedback and ideas are represented in the final product. We also had another comment that reads, "It all sounds so overwhelming and great. When looking at the design of campus and incorporating the community, I hope you mean that all the communities that have been served by this campus and all that can be served in the future. We need to look toward the future as not to be caught unaware. As a level 1 trauma center, there should be no limits." I think that really reflects back on the importance that the LAC-USC Medical Center has in the heart of this community and as a flagship medical center for our county. As a level 1 trauma center, we need to be sure that this campus continues to provide the best-in-class service and is able to pivot to new health needs. We certainly saw that during the pandemic, the incredible importance of having a medical center that could flex to respond to the emerging needs of the community. Final comment. Many thanks to the directors of programs and projects. Many thanks to the speakers. Many thanks to Supervisor Hilda Solis, to the Senator. Thank you. Thanks to Assemblywoman Carrillo. Thanks to all the people who have been interested in the community. They deserve to be recognized for all their work and effort. They deserve our respect and gratitude. We wanted to end with this particular quote because we just wanted to reflect upon the fact that so much incredible leadership has come forward to be part of this project. Supervisor Solis has had this vision for years at this point, that this campus can be something really significant in the future as a community serving space, as a hub for affordable housing, resident services, and of course, furthering the goals and the needs of our healthcare system and of this incredible medical center. And we're just very grateful that so many people are rallying around this potential opportunity to really maximize what becomes possible here at the campus. We also wanted to reflect on a lot of the questions and comments we heard through the process. We received many questions, some of which we were able to answer in real time at our meeting, others of which we had to take offline to craft better answers and more complete answers, I should say. And those are all going to be posted up on the HICP website, but I thought I'd just highlight a few right here. One of the questions raised, why are commercial office space and market rate housing included in the feasibility study? An excellent question, and we've heard it a lot from the community. And we wanted to reflect back to everyone that the project needs to combine community needs, county requirements, technical issues, and financial feasibility to ensure, as Supervisor Solis has said, that we receive responses from multiple best-in-class developers to transform General Hospital and West Campus. And then a follow-up that we are still evaluating how a mixed-use project can be financially feasible. So we just want to reflect that all potential uses are really being considered for the campus at this time as we come up with a reuse model that will attract best-in-class developers to bring forward creative and inventive approaches to being able to create a community-serving campus here at LAC USC. We received another question about, will the building include services for homeless individuals who have the dual diagnosis of drug addiction and mental health illness? We were really delighted for this question because it was such a perfect segue into our our county experts panel and the conversation about the Restorative Care Village, which is exactly designed to meet this purpose. The Restorative Care Village, as we know, is ready to open momentarily, anytime now. The ribbon will be cut and we'll be opening and welcoming people to take up residence at the Restorative Care Village, which is comprised of the 2 service hubs, the Recuperative Care Center, as well as the residential treatment programs. And that is exactly to take care of people with unstable housing and high medical, mental health, and substance use needs. So we're delighted to be able to respond back to community that those needs are being addressed, not necessarily in the General Hospital building itself, but in the complementary buildings on the campus. And then there were several questions about accessibility and green space and connections back to the larger community. So we were delighted to see a question about efforts to ensure greenways for travel, such as running paths, walking paths, bike paths around the campus, and a connector point to Cal State LA to give a longer opportunity for connection as well as exercise routes. So we're also really happy to have with us today two presentations about transportation updates related to Metrolink. So there are a lot of accessibility and connector conversations going on as part of not just the feasibility study, but also other project opportunities as well. And we hear you loud and clear that making sure that any new developments on the campus are really ensuring greater accessibility for people of all levels of mobility, as well as greater access points that don't necessarily rely on cars and really encourage people to be able to take safe walking and biking routes to our campus and around the campus and community. So anyway, some of the representative questions that we received at the community at large meeting, like I say, we just wanted to share those back with you. So now I wanted to ask if anyone who is with us today participated in the community at large meeting on the 17th and has any reflections or comments that they might want to share out. So I see here a couple questions in the chat. From Pam Augustine, she asks, AECOM was doing a market and demographic study. Are their findings ready? Those are indeed underway, and I do not believe those are ready to be publicly shared yet, but I can ask if Ivan Matthews has a more comprehensive answer than that he'd like to share.
Good morning, everybody. Can you hear me?
Yeah, you sound great, Ivan.
Great, thank you. Pamela, thank you for your question. Before the feasibility study was paused in the spring, summer 2020, we did share some of that market study information and some of the highlights along with some of the high-level demographic information. The feasibility study is going to be complete with a board report back at the end of April, and more detailed information regarding the market study and demographic information will be made available then.
Thank you, Ivan. I also see a question here about the participation of Assemblymember Carrillo's and Senator Durazzo's offices, and I believe those have been that particular question has been addressed by Guadalupe in our chat. So thank you, Guadalupe, for chiming in. We're delighted to have the participation of Assemblymember Carrillo and Senator Durazo in this project and at the HICP table and in all of our projects hitting the East Side neighborhoods. Daniel, would you like to ask your question?
Yes, hello. Daniel Jimenez here, organizer from the East Side Inner City Struggle. And I wanted just to first share my experience, right? I remember attending these meetings. Actually, in this photo, you can see one of our team members on the background here, you know, like, and through this engagement that we had, right, at different sites, from you know, going from Northeast to you know, Boyle Heights, to different, you know, like engagement points that, you know, these meetings were taking place. We were taking our community members to these like meetings, right? Sometimes running, you know, till like 8, 9 p.m., right? As we were, you know, driving them back home. And, you know, the engagement here, you know, in these meetings was something that community really value, right? That really value, you know, in a sense that they really saw the, you know, the importance of their voice being heard, the importance of, you know, their needs being met, right, with this development. And so my question is, right, as we get closer to selection or to getting, you know, this report out there, right, how are we going to ensure that, you know, those voices, right, how are we going to ensure that those needs that, you know, the community comes in with, which a lot of them, you know, just to share, are grounded on affordability, right, are grounded on access, are grounded on the needs of the community. How are we going to ensure that, you know, these needs are going to be carried out not only through the creation of this report, right, but also through the selection and through the construction, right, of the project? Because I think it's super important that we really talk about affordability, right? Not in the sense that affordability is being defined at the moment, right? Where you're talking about a certain percentage or a certain amount of money that you need to make. The reality is that some of our community members have come to me in particular and say, you know, I have applied for affordable housing and I don't qualify. And I don't make enough money, right? I'm below the, you know, the minimum that you can do so that you can qualify for affordable housing, and I don't qualify. And so those are the folks that, you know, really, you know, I'm thinking about. What about those folks that are below, you know, the medium income, you know, are far below the medium income, right, for the area. They are currently being driven away from our communities, right? Like a couple members that already have been driven away by displacement, and some of them that are right now, you know, being displaced and cannot find a place on the East Side, a place on their community that is affordable for them. So that, yeah, thank you for listening. That's my question.
Yeah, thank you so much, Daniel. And of course, I mean, that I think has been one of the preeminent concerns of the Health Innovation Community Partnership Table, as well as this particular study project, the General Hospital Feasibility Study, is that sense of affordability for this community. And how do we ensure that this project, as the study moves into future phases, that those concerns are heard loud and clear. And I know that we can speak on behalf of the supervisor's office in saying that she too has heard these needs, and she feels them very deeply, that there is a crisis on our hands with housing affordability and homelessness in this neighborhood and the larger county as well. So as we look at this particular study, which is a true mega study, it is such a large project when you think of 19 floors of General Hospital, as well as open parcels of land on West Campus. There's going to be a lot of opportunity for different needs and uses to be brought forward. And the project has, through Supervisor Solis's direction, the project has committed to doing better around affordable housing than you typically see in projects, both with the percentage of units that are going to be deemed affordable, but also the affordability levels. The specifics you're mentioning about particular people that qualify for one level of affordability or not, I'm afraid I don't have enough expertise to really respond to that and to say, like, how do we make sure that the most vulnerable members, you know, have their access and have their opportunity too. That's a very challenging situation. That he looks at what's possible, creates a reuse model for what is, you know, what it's going to cost, what the technical considerations are, what counties' needs are, and it lays everything out in a framework that is then adopted into the RFP phase. And then we allow the proposers to kind of come back and respond and say, yeah, this is how we can cover the bases that have been required through the RFP process, and then allow some level of flexibility and creativity to make sure that we some creative approaches. That is, I like I say, I don't have more specifics on the affordability levels other than, you know, I can definitely direct you to the materials that are available on our website, where there is an affordability housing fact sheet, and it talks about the different levels of affordability that are being considered and will be included in the study. And then, of course, once again, the commitment to, you know, to do better than traditional projects, both in terms of numbers of units of affordable housing and the levels of affordability. And I see Guadalupe is joining us, and I think she probably has some other wisdom to share. Guadalupe.
Hi, good morning, everyone. We hear you loud and clear, you know, Danielle and Ruby and everyone. You know, I think this is not a new message, and you know, we are definitely hearing that, and we are working actively on how do we fold that in. It is definitely, you know, a top priority for the supervisor to maximize the affordable housing at this, you know, key catalytic site. And that's why we're working very closely with Assembly Member and Senator's office, because we understand, I mean, you know, the big costs involved with, you know, the reuse of General Hospital. And I think all of you know that. That's not new news. So that's why we understand, you know, that there's a big need to fill. It needs major retrofits. It's costly, and that's why we're actively engaging, you know, our state partners, you know, to help us. And they see the need for this site. They see the vision. So we're very hopeful that, you know, again, the message is clear to us, and we're supervisors 100%, you know, supportive of maximizing affordable, and we will be working with all of you, you know, and so we look forward, you know, to the next steps. But thank you for your comments.
Thank you so much, Guadalupe. I see Pam, you have a hand raised as well.
Thank you, Heather, and yes, thank you, Guadalupe. Yes, no, I guess.
I'm sorry, Pam, if you're speaking, I really can't hear you. Can you please speak up?
Can you hear me now?
It's so faint, I personally cannot. Are other people having trouble as well?
There's multiple times. How about now? How about now?
Better. It's getting better. Keep doing what you're doing. It's getting better.
Woo! Okay. No, but can we, you know, we know there's this timeline. We know that in the summer, an RFP, request for proposal, is going to be crafted and sent out, and bids are going. This is something that we learned from the group last month. What is still unclear to me and to members that attended this meeting is what specific guidelines can we actually influence in that RFP? If, for example, in 2019, through the engagement that Danny and other organizations did, we heard overwhelming support for affordable housing, or overwhelming support for neighborhoods serving retail versus commercial retail, right? Street vendor support versus, I don't know, a Whole Foods. Like how will those very tangible, real comments guide the RFP that developers then need to apply to? I think I still don't understand that, and members walked away from this meeting not understanding that, because we have said very clear comments throughout the years. It would honestly, it would really not be helpful if a new developer wins the RFP and we have to start this process all over again of let's envision what you want for this site. Well, we know what we want for this site. This is the space that has guided that vision for that site. It would be a waste of time to have a new developer, a new team come into this space and want to start from scratch when we already have the ingredients of what we want to see. What we don't have is the design.
And Pam,
Yes.
on that question, you know, that's why we've brought on, you know, our partners at the Economic and Workforce Development Department. There's going to be consultants that are going to be brought on board to actually work just on the RFP. And that language that you mentioned, you know, what is our goals? I mean, we are looking to put language in there that specifically talks about what is our goals, what is it that we want, you know, the kind of commercial. You know, we have the ability to put language in the RFP, you know, so that we can get responders, you know, in regards to, you know, those the bigger goals and you know, so that's definitely something that we will be working on. And I know all of you will be part of that, you know, process. We're trying to figure out, you know, the best way to do it. But, you know, we are actively, you know, working with that department to help us on that, you know, endeavor.
Thank you, Guadalupe. Yeah, I think one thing I want to reflect back to your question, Pamela, is what's very exciting right now about the feasibility study is that we actually have an RFP coming very, very quickly. And that was not necessarily true in 2019. So I do not believe that any of the efforts of community engagement and the community conversations will be lost. I think they will all come forward, and we're really excited about that. And then but if you want to ask RFP questions, we have Mr. RFP himself with us. Currently moonlighting under the name Sophia Wang, we have Doug Cohen with us. And Doug, would you care to respond to Pam's question about how we're going to incorporate all of this incredible community engagement and feedback as part of the RFP process? Thank you.
Yes, and Heather, I'll make sure that I change all my monograms now to RFP. Okay. But yeah, Pamela, it's an important question. There's a snapshot, a compartmentalization of all of the work that has been going on for the last 3 years as part of the feasibility study and the community outreach component to that study. That whole element is going to be brought into the RFP in terms of standards and requirements. Specifically, what the standards and requirements are, literally, we haven't even, the baby hasn't been born yet in terms of the process of actually initiating the RFP yet. But over the course of the next 6 to 8 weeks, it is going to start to take a formulation. But so there's, I almost want to have you think of it as, and I'm addressing Pamela's question specifically here, it's about process. I almost want you to think that there's 2 parts to the community's input in the selection of the developer. And more importantly, it's the project that is coming out of this process. So you've got the selection of the developer, but you also have, you know, you don't care so much about the developer as you care about the actual final product. And that final product with respect to the RFP is going to have 2 components to it. You've got the entire body of work that's coming in from 3.5 years of community outreach here. That is going to be brought in, as I said, in terms of standards and requirements. And what those standards and requirements are, literally, we haven't actually sat down with our consultants yet, but it is going to start to germinate over the next 7-8 weeks. But once that happens and the RFP comes out, the developers are in fact going to be responding to a series of requirements that really do direct toward the input from the community here. There's a second component to this. Once the developer is selected, the development process has a series of steps after the developer is selected. When the developer is selected, that's when all of the agreements start to get negotiated, and that's a very involved process. It can take years. And quite frankly, part of my hope is that we can shorten that period of time of negotiation dramatically, because the more we can shorten the period of negotiation, the quicker you start to see the realization of your project. But in that negotiation period, so after the RFP has selected the developer, and the developer is selected in part with respect to the assessment that is made on their addressing the community input in the RFP requirements. Once that developer is selected, and during the negotiation process with the developer to get a development agreement, there will be, the developer will be driving and will be responsible for an outreach plan. And that outreach plan that the developer, and this is a requirement of the RFP is going to require the selected developer to come back and to meet directly with the community. And that outreach plan is going to be part of the description, the project description that the developer then puts into his application. And so there's going to be all of the work that you're doing right now with the community. And then after the developer is selected, you're going to be able to come back and work directly, not through intermediaries, directly with the developer. And I'll stop there if there's any questions.
Yeah, thank you so much, Doug. I did want to reflect on one question from Ruby Rivera, and there is actually a lot of active questioning in the chat. Ruby asked the question about how prescriptive is the RFP going to be, and I'm going to give my answer, and then you can fill in with yours. And essentially, Ruby, I think the RFP will have guideposts and goals and the concepts that the developer must respond to, but it won't be prescriptive to the degree of X number of units of X number of square feet of X. I think that's the level of prescriptiveness that we're saying will not be part of the RFP process, but the big broad framework will be. Those ideas are coming forward as part of the RFP process. Do I have that right, Doug? Is that close enough? On that question of prescriptivity or prescriptiveness.
No, I think it's right. And yet, I think we all know that the more specificity we can provide in this forum, the better. And yet the specificity that we want to provide in this forum is answering a question about the lack of, specificity in terms of prescriptive elements that we're requiring of the developer. So for the forum today, again, and I hope everyone understands, I'm not attempting to be purposely ambiguous in any of this response here. It's a very important process, but an RFP process is we're trying to hire the best in class developers. We want them to come to us with, quite frankly, things that are going to be pleasantly surprising to us, things that we hadn't thought of. And a lot of this is driven by leveraging the developers against each other in a competitive market place for the award to bring not only cost of efficiencies in terms of construction, but also cost of literally the efficiencies in terms of their cost of relationships to their financing. This is all going to come around a set of circumstances that in terms of requirements for the developer to address, those set of circumstances are in fact going to be addressing in no small part what our expectations are. Now, expectations are not necessarily requirements, and that's an important element for the forum to understand. The expectations are clearly an area in which we are directing the developers in a competitive market with each other to really sharpen their pencils. And so, for instance, with respect to affordability, that's up to them to compete with just how aggressive we can set the bar in terms of our expectations. But we want the developers to compete with each other about just how they're going to approach a very aggressive affordability component. And that type of that premise actually extends beyond affordability. It extends into the quality of the final product. It extends into the timeline and the phasing of when that project is going to be delivered.
Thanks so much, Doug. Oops, I see we have a question or a comment from Rosa.
Heather, if you'd like, let's take the rest of the questions that are on, and then I'll make my comment after, because the questions were there before I raised my hand.
Yes. Okay, I'll ask Juliana to please come forward. I've been asking her to kind of synthesize the different questions that are coming through the chat and seeing what we can respond to. There's a question from Ruby about leveraging creativity and cost efficiency while upholding the amount of housing and types of commercial use the community is asking for. So I know, Ruby, from the conversations that we're able to participate in, all the different funding opportunities, funding streams, and funding layers, both for affordable housing, for other forms of financing, for grants, for subsidies. There's really a lot of consideration being made around creative funding streams and blending and braiding funding streams to really make this a feasible project. So I do believe that there is so much of that is happening, but if there's anything more that either that anyone else on the project team would like to respond to around cost efficiencies, please weigh in. And that could be Ivan or Doug or Guadalupe.
I can jump in here and a little bit on this. So one of the areas that is so important, and it's absolutely a benefit, is at some point, and I'm actually somewhat new to this project. The CEO obviously has been involved for a while, and of course the district office has been involved for even before that. But the scale of the project provides tremendous efficiencies in terms of the consolidation of of various efforts. There's not a silo development going on here, and that is so important. We've got 25 acres, and the site, the entirety of the site is what we're talking about here. And so you're not getting a piecemeal approach, and with that, you're going to have significant cost efficiencies. That again, we go back to making sure that the developers in a competitive market. We've got 25 acres here. There's a lot of complexity. They're the experts at doing that, but they are this is a competitive environment, and it's because there is a breakdown of the silos. We're not putting one section out to RFP and then in the shadows of that developer trying to hire another developer in the shadows of yet another developer. And so there will be efficiencies, and with that, those efficiencies will drive better quality, and they will drive a more consolidated timeline for the overall project delivery.
Thank you, Doug. I'm going to we've really kind of unfortunately run through our time on this particular segment, and I super appreciate everyone's questions in the chat. We will take them offline, and I'll ask if we can get some written responses back. But I see a couple questions related to kind of community and involvement of like our community engagement steering committee and others in the developer selection process and negotiations. I just want to reflect back that we are definitely considering all of the future community engagement opportunities and what that's going to look like. That's still in conversations with the supervisor's office and the study team and then the RFP team about exactly what that's going to look like. But I know we are very excited to continue the work of both the Health Innovation Community Partnership and the community leadership in those future conversations of the RFP phase and beyond. I also do see a question here about, let's see, I lost the question now. My apologies. Let me see if I can find it again. Oh, and Monica had raised a question about funding for housing for homeless people, but like not adequate or sufficient funding for low-income people. So I know, Monica, that we're also looking, there are a lot of, it's a time right now where actually there's a lot of interesting funding streams related to building affordable housing and to creating more affordable housing for people at different levels of on the lower income spectrum, so that it does meet different levels of affordability. And that is definitely being considered as some of the funding opportunities and funding streams that will be part of the feasibility study. So definitely hearing that, but I think it is funding streams for a full range of people, both from from the kind of many different levels of affordability from the income spectrum. I think we have done, I hope we've covered so much of what you've raised, and I really appreciate the rich conversation and questioning, and we will definitely circle back on so many of these ideas and issues that you've raised. Rosa, do you have a final comment you'd like to make before we pivot to the next segment? You are muted, Rosa, if you're speaking to us.
Oh, sorry. Yes, thank you so much, Heather. And I apologize for the confusion earlier. The reason I wanted to hold my comment was because this is exactly the richness of conversation that we were hoping for when the Health Innovation Community Partnership was established. And it's an opportunity for us to reimagine how we conduct business as partners, right? With the county, with the community, right? And so this is exactly the richness of conversation. And thank goodness that we have the Health Innovation Community Partnership that can monthly continue a through line. The other thing, when I heard Doug say, we just haven't written it yet, I feel like that's the kind of space we're in. And I certainly, as a community member, and having grown up in this community, like really feel that the concerns of the community are urgent, are emergent, are, just ever most important today, as we're continuing to get through COVID and move forward. And the need, and they're dire, right? And so I know that that's really important. I know it's important to everyone at this table. And so I also invite us to remember that when we say, like it hasn't been developed yet, it's because most of the time folks don't come to the table, especially from county departments or from strategies, until they're further along in a process. So this is the experiment, this is the opportunity, right? That we are on a journey together, that we are learning from each other, and that we are trying our very best to anticipate opportunities, right? Where we can do more, we can do better, and we can respond to the emergent and urgent needs. And so I think for both sides, I don't think it lets any of us off the hook, not the community, not the county, not the business, not the developers. But I do think that, we open our hearts and our minds and our opportunity to let's sit at this table together and continue to bring up the important issues and the opportunities so that we can continue to move forward as the strong community that we are. So thanks so much.
Thank you so much, Rosa. And we're so excited to have Doug join us here today. And Doug has, lucky man, has agreed that he'll be joining us more regularly at our HICP table. So I think next time we'll be sure to add a little more time on our agenda for this segment. So questions that we were unable to fully get to today, we will continue the conversation and the dialogue, as Rosa says. This table is really an important one for having that opportunity to really interface with county and raise those community questions and concerns. So thank you so much, Doug, for your time, and we'll see you soon. Any final closing words?
No, thank you very much. And I would think that a month from now, we're going to actually have some steps that we can direct some of our conversations to. So we're definitely going to be getting underway with this RFP process. So exciting. We all can't wait, basically. All right, so before we move on from this segment, I just want to mention again the HICP website. We have materials from our community at large meeting, the recording in English and Spanish. So if you're looking for a refresher, if you missed the meeting, please do visit us. It's all housed on our HICPLA.org website. There's a General Hospital Feasibility Study tab, and the website is available in English and Spanish. There's a button at the top that you can toggle between. So here's what's coming up next as it pertains to the General Hospital and West Campus Feasibility Study. We've had our community meeting February 17th. We're at HICP today. There's a Wellness Center site tour that's coming up. I'll be telling you a little bit more about that in just a minute. And then we have presentations scheduled both at the April HICP and the May and June HICP. So this will be a regular conversation. The things that we didn't get to today, or maybe we didn't have full response today, we'll be able to readdress them
at a future meeting. So that's good. We also are planning to go out to neighborhood council meetings in the month of April, and then we'll be hosting another community meeting where, an evening meeting, everyone's invited, and that is going to be scheduled for that mid to late April timeframe. We also have the community engagement team is available to come present and make, to invite the conversation in other community spaces. So if you have a meeting or a group where you'd like one of our community engagement presenters to come, please let us know. We'd be delighted to join you and, and kind of present the materials in their current phase and take back your questions. Okay, so as mentioned, one of the upcoming opportunities for community to kind of get a little more information on this study is joining us at our Wellness Center 8th anniversary. The Wellness Center, as we all know, located on the first floor of the historic General Hospital. This is our 8th anniversary this year, and we're so excited to be back in person. After 2 years of virtual celebrations, now we are going to be bringing community back to visit with us and to celebrate with us on Saturday, March 12th from 11 a.m. to 2 p.m. You'll see that we're going to have music, entertainment, a health fair, activities and prizes, and very pertinent to the purposes of the study, we're going to be having a little site tour / visit where people can kind of observe various aspects of the General Hospital building, get some additional information on what's being considered, as well as looking at those parcels of land on West Campus that are under consideration as part of the feasibility study. So it's a nice opportunity for those who want to familiarize themselves more with the elements of the space itself to come join us on March 12th for that opportunity. All right, so here we are. Matt Lust has joined us today to give us a quick update on what else is happening on the campus. In particular, he has an update for us on the permanent supportive housing project, kitty corner to the restorative care village. Matt.
Thanks, Heather. So I just wanted to provide a brief update on what is happening with the permanent supportive housing restorative care village project adjacent to the campus. So if you'd go to the next slide, please. Thanks. So we've talked about this project in the past. It's a county-owned site in the city of Los Angeles, rather large, triangular shaped, bounded by Alhambra, Mission, and Griffin. And the proposal for the site, or the idea for the site, is to produce up to 300 units of affordable housing with a mixture of housing specifically set aside for residents with that are living with a mental illness and who are homeless as well. So it would be a rather large project, a portion of those set aside for homeless individuals, as I just said. And we are in the development, we're in the evaluation phase of the responses to our RFP. So we received 7 proposals for the project. We had a little hiccup in our timeline as one of our staff was out on medical leave, but now they're back. So on Monday, we should have a summary of the proposals. We will develop the timing for the panel to review the proposals and select the developer. And we hope to have that done in around 2 months. After that, we will go to the county board for approval of the selection. And then we'll start working with the developer on what the project looks like and the components of the project. With this portion, the developer will provide us with kind of a basic layout of where the buildings would go on the site, but will not have any sort of detailed plans on kind of the look and feel of the project. They will come back to the community members and community groups and discuss what the design of the project should look like and how it fits into the community. So there will be an opportunity for input on how the project looks and the development of the site as it goes forward. So I know that was a rather quick update, but we will be selecting the developer relatively shortly, and we'll come back with more information as we go from there. And the developer will also be under a community benefits agreement that will state various community benefits that need to be incorporated into the project. So we're still at the beginning phases, but we're starting to pick up steam, and we will be selecting a developer soon.
Thanks so much, Matt. Do we have any questions for Matt about the The project here that's going to be kind of kitty corner to our campus, that permanent supportive housing, 300 units of permanent supportive housing. Any questions about the process and what comes next?
Yes, kind of like, what is that in dog years? 300 units in that size lot. How many stories is that? Just wondering.
So it's up to 300 units. So that is the maximum that can go there. There may be fewer units proposed. We don't have full, I guess, evaluation of the project. So we don't know yet how many stories it would be. So we're still in the beginning phases of project selection.
Right, but just from a standpoint of if they went with the max 300, how would you fit that?
So that would honestly depend on how many buildings were proposed. It doesn't have to be just one tall building in there. There's enough room that it could be spread out into smaller buildings if the total 300 units was proposed. As far as height, I honestly don't know how high that would be, but they are constrained by the planning approvals that could be garnered for this project.
Also, is there any specification for family size units, you know, like more than one bedroom, more than a studio, in fact, 2 bedrooms or more?
So we did not get into that specificity. We are leaving that up to the proposals to meet the needs of the site and the community. So we did not say there has to be X number of units of any kind. But we do expect there will be some mix of units in the final proposal.
Right. What I've seen is a whole lot of studios being put in. The other final question is, in terms of process, does this fall under SB 35 and will there be public hearings around it?
That I'm not sure. That's more of a planning question, and I unfortunately don't have that answer.
Thank you.
Okay, and we have a question from Monica.
Hey everybody, good morning. I guess I kind of wanted to ask a similar question that I asked about the hospital site. Is sort of, is there any way we can find a way to find opportunities for general affordable population? And it's really more at the extremely low, like even 15% AMI, 15 to 30% AMI levels, which those folks are going to need Section 8 too. And there's lots of homeless housing options coming up, which tend to be studios and ones because that's how the household sizes are. But we just see a tremendous need for, you know, very, very, very low income people. And they honestly probably need Section 8 too. It's just, I haven't seen anybody serving that. With the funding just doesn't really it's not set up. Is there any possibilities of helping that group of people?
So thanks for the question, Monica. So you are correct. Most of the funding in the state is geared towards supportive housing and less towards lower income, you know, non-special needs or non-homeless housing. That is kind of the development of those units is a function of the funding that's available. We have seen generally in our projects that we fund a mix of about 60% supportive housing to 40% general affordable housing that is not specifically identified to or geared towards one population or another. So we would expect the same kind of ratio from this project. But again, we don't have the final application or the final selection of the developer or the unit mix in order to relay more information at this time.
Yeah, thank you, Matt. I know, you know, we tend to do those, mix them up like that too. And for folks on the call, I'm with ELAC. It's an affordable housing developer. It's just that we wind up those, for feasibility reasons, the general affordable units wind up being at 50 and 60% AMI. And so there's a group of people who just, it's very hard to include them. And I feel like we're just leaving some people out from the community. And so I really want to just try to find ways. And I do kind of think it probably needs Section 8. And so HACLA and HACOLA haven't really been pushing out vouchers for general affordable, especially at those low levels. And it's just something that's needed because there's nobody serving that group of people.
Right, yeah, I understand.
Yeah, thank you, Monica. And I think maybe that's a question we might also kind of try to address a little more fully at our next meeting, because I think it's an excellent question that really goes beyond the scope of either of these individual projects. It's more of a systemic issue. So thank you so much for raising that. With no more questions from Matt, we're going to move along. As I know, we're running a little late in our agenda. Oh, I do see Guadalupe showing up to maybe make a final comment on some of these affordable housing programs.
Just on the question that Adi asked about, in terms of the entitlements, again, we're early, we're really early on the process for the triangular, parcel. But given that it's county property, we have the ability to exercise the county's planning powers, which provide more flexibility, right, in terms of what's allowed, the height and other, other requirements. So we have that process, as well as SB 35, right, that is there to facilitate housing, and it would be applicable here. And so, but again, we're really early on right now. They're basically, looking at first identifying, they're shortlisting, if you will, out of those that basically applied, and after they shortlist, they're gonna select one to basically to basically vet out a proposal. And so, this is early, but in terms of planning, I just wanted to share with you, we have that ability to exercise the county's planning process versus the cities, right? And, knowing the supervisor, we're very much on community engagement. Even if the planning facilitates, the entitlements, we're going to want engagement. That's something very critical for the supervisor, and you will have that.
Thank you, Guadalupe. Yes, we're so excited. Supervisor's been such a wonderful, I think, advocate for that community voice, and helping establish this table here today, as well as really putting so much emphasis on community engagement and the other projects in these areas. All right, so with that, like I say, we're going to be pivoting on to the remainder of our program. We've got 3 more incredible presentations coming up, so I ask each of you to kind of bear with us. We may be going a little bit over time today, but you won't want to miss out. I'm going to kick it off by inviting Janet Scully, Beatrice Trujillo, and Jenica Robles to talk with us about lead-free homes, a new program to kind of look at making homes lead-free in the East Side area. So with that, I think Janet's going to start the conversation with us.
Hi, everyone. Good morning. Thank you for the invitation. We're super excited to be here to tell you a little bit about Lead-Free Homes LA. I think I'll jump right in, seeing that we are a little short on time. I'm going to just kind of touch a little bit on an overview and background of the program, and then I'm going to turn it over to Beatrice, and she's going to really provide more details on program implementation, how folks can see if they qualify. We have some additional resources, and then we'll take some questions. So to start us off, this is a program that's relatively new, and it's really formed out of a substantial, to say the least, a lead paint company settlement of $134 million. This is a historic settlement with lead paint companies. And in the agreement, these lead paint companies will pay the county, LA County, about $20 million a year over the next 7 years. So we've received 3 payments so far, starting in October of 2019. So we hope that this program will really run for at least 8 years, probably more like 10. Basically, we will, implement the program until there are no more funds left. This is a program that funds remediation for lead paint hazards, both in interiors and exteriors of residences throughout LA County. We're really focusing on the most vulnerable populations, so those families that are most at risk for lead poisoning. And that's the group that we're really trying to prioritize for the remediation services. We're also really paying very close attention and accepting referrals from our childhood lead poisoning prevention program. That's what HICP stands for, so that we can remediate lead paint hazards from homes where there's already a lead burdened child present in the home. Next slide. So there are actually 3 kind of main sources of funds. I'm not going to go into a lot of detail. I think the slides will be provided to you. So I already mentioned the lead paint company settlement. We also have another settlement from the Aliso Canyon gas leak that was really earmarked for the Exide impacted communities. And that's an additional $5.2 million we received back in July of 2019. And then recently, the county was awarded a HUD grant for an additional $5.7 million that can be utilized for lead paint hazard remediation. So, I mean, folks don't really need to be concerned with, the various sources of funding and which they qualify for. In partnership with LACDA, Public Health, we're working together on the back end to determine which sources of funds would be utilized for each of the remediation projects. So we don't want folks to be concerned with this, but we want to be really transparent about the funds that are available for this work. Next slide. As I mentioned, we're really targeting certain regions in the county, and Beatrice will actually be showing you a map that kind of shows the phased approach we're going to be taking with our remediation services. But in general, we're really looking at communities where there's a large number of pre-1951 housing, where there's a high prevalence of low-income families, and a significant population of kids under the age of 6 who are the most at risk for lead poisoning, and pregnant women as well. So really, we're focusing highly on kids that are already lead burdened, as I mentioned, kids under the age of 6 who are the highest risk, pregnant women who are also very high risk, and really looking closely also at some of these environmentally disadvantaged communities, which the Exide kind of falls into that category. So I'm going to stop there. There's so much more I can say, but in just a few minutes, that's what we really want to touch on is the highlights. So I'm going to turn it over to Beatrice, and she's going to kind of guide us through some of the details of the program. Thank you.
Okay, so let's now cover where and how we use these funds that Janet just mentioned that we received for the Lead-Free Homes LA program. So what you see here is the focus area. This is where the Lead-Free Homes LA program is being offered in the 1st district, and because of recent redistricting, some of the 4th district as well. We initially launched the Lead-Free Homes LA program in 2019 in the areas that were impacted by the Exide battery plant. That's the center portion of this map titled Exide. We initiated the program in the cities of Huntington Park, Bell, Maywood, and East Los Angeles. Then COVID hit, and the program was placed on hold in March of 2020. In April 2021, we resumed our program, and by this time, we had received the funds that the lead paint company settlement provided, and we were able to expand our program to include the remaining portions of these Exide communities that you see here in the blue, red, orange, and pink. Our program is offered on a phased approach, meaning we outreach and enroll in an area for only a certain amount of time. Then we move on to the next phase. For example, phase 1 is Huntington Park. We started in Huntington Park in August. We conducted the outreach and enrollment there for 4 months. Once the 4-month period was over, we moved on to phase 2. Phase 2 is Boyle Heights. We started our 4-month outreach and enrollment effort in Boyle Heights in mid-December, which means we will complete our efforts in Boyle Heights in mid-April. Then we'll move on to phase 3, which is East Los Angeles, and phase 4, which is cities of Commerce, Bell, and Maywood. Once we finish the outreach and enrollment and we leave the area, we will not return to it. So it's important that the community is aware of the program while we're there. The remediation work, the actual construction or remediation to the home, however, is not limited to a certain time frame. All those that enroll in the program and whose property tested positive will receive the removal of their lead hazards regardless of the time that it takes. So to ensure that there's awareness of our program, we have partnered with Impact Assessment. Impact Assessment conducts the outreach and enrollment efforts for this focus area. Impact Assessment was selected because they are well known and trusted by these communities. Impact Assessment has done a great job in casting a wide net by sending out over 2,200 mailers to Boyle Heights residents, which includes a letter and a flyer about our program and how to apply. They send out postcards to remind the residents to apply. They do door knocking, they make phone calls, and they attend local events, all in an effort to let the residents know about our program and encourage them to apply. We also met with the local stakeholders to conduct a meeting and just a discussion so that we can network with them and leverage their resources as we see them as the trusted advocates of the community who can help us to get the word out. We have also a vast media campaign that includes text blasts to the residents, advertisements on bus tails and in bus shelters and at gas stations. We have postings on Facebook and Instagram, infomercials on Pandora, flyers and brochures are provided at doctors' offices. In fact, 55 pediatrician and OBGYN offices in Boyle Heights received our flyers and our brochures to hand them out to their patients. And there's large standing posters at 4 local Boyle Heights churches, 7 grocery stores, 5 community centers, all in Boyle Heights. We really want everyone to know about our program while we're there. Our goal is to really saturate the area with the program area so that all, again, know we're there and can apply. Speaking of how to apply, let's move on to our next slide, please. To apply is very easy. We have a website that is pictured here where you simply go and you push a button and it takes you right to the application. The application is simple and asks very basic questions. Or if they're not comfortable to sign up through the website, they can simply call Impact Assessment, and Impact Assessment will take a verbal application over the phone. Or you can also arrange to meet with Impact Assessment and they will help you complete the application. Our website not only has the application and program information, but it also has resources. Our program strives not only to remediate, but also to educate the public so that our resources so we have resources here on health and wellness, tenant rights, and other useful resources. The website's in English and in Spanish and really can translate to any other language that's spoken if you select the Google Translate. Next slide, please. Okay, so let's talk about what happens when an application is submitted. The application's reviewed and approved, and it takes about 2 weeks or so. Once it's approved, we call the applicant and we welcome them to our program and we advise them of the next steps. The home is then scheduled for a lead test. This can take a couple of weeks as we need to set a date that works best for the applicant. The home is tested on the inside and the outside. And once it's tested, it takes about another 2 to 3 weeks to receive the lead results, and we notify the applicant. If there's no lead hazards, that's great news, and we notify the applicant and no other work is required. If there are lead hazards, Then our inspectors schedule a site visit to the home, and they decide on the scope of work that's necessary to remediate the lead hazards. After a few weeks of putting the scope of work together, the home visit is scheduled. During this visit, the residents informed of the work that will be done and their relocation needs are assessed. After the home visit, there's a 30-day notice issued, and this basically allows us to order any necessary materials such as doors and windows, and also allows the family to make arrangements for relocation. The work begins and completes, and the family returns home to a home that is free of lead hazards. All right, next slide. The Lead-Free Homes LA program that is currently offered in Boyle Heights is to single-family residents that are occupied by the tenant or the homeowner. We understand that this group has raised concerns about why we're not offering this program to multifamily units as we do in other communities. Well, we have worked with the City of Los Angeles for quite a while now in an attempt to execute an interagency agreement that would allow us to offer this program to properties up to 4 units. But unfortunately, that agreement has yet to be put in place. So for now, we can only offer the program to single family residences. But the good news is that the city already offers a program for single and multi-family lead remediation. In fact, here is their flyer. So for anyone that lives in the city of Los Angeles, they can participate in this program and receive the same type of services that is offered in our Lead-Free Homes LA program if they're eligible. In fact, we never want to compete with any of our jurisdictions' program. We aim to rather complement by adding in our program for a temporary period. And by offering in our program in the city of LA, the city then can stretch their funds further and assist more homes. And that's always a good thing. Next slide. As I mentioned earlier, our program aims to not only remediate, but also to educate. So we wanted to close our presentation by listing a few resources here for you to look into and to share. If you have any questions after today's meeting, next slide, please. Here's our contact information where you can reach us. Any questions?
Thanks so much, Beatriz. And next up, we're going to have a presentation by another colleague, Jenica Robles from the Impact LA. So we'll have her do her presentation, and then we'll take questions across the 3 of you on the program at that time. Jenica, welcome.
Hi, thank you so much for having me. You know, Beatrice went over most of the enrollment part, so you can skip some of these slides. That's our program flyer. Impact assessment, as she said, is the team that's out in the field, helping folks get enrolled and passing out flyers, doing the door knocking, and the email campaign or the mailing campaign. So she went over the website and how to apply. Our enrollment specialist, her name is Adriana Pacheco, and she's a live, real person that people can reach if anybody's having any technical difficulties or need help on the back end with their application. She can absolutely help with that. And then I'm the community engagement coordinator, and you can skip over to the next 2 slides. And so I am helping to get any organizations that want to help out, pass out program materials, schedule a meeting such as this one with community members or other organizations to do a presentation on how to get enrolled in the program. We can get you materials on to post on your digital media, such as newsletters, on your website, social media. And then we'd also love to attend any outreach events where we can actually engage with the community, set up a table, pass out those program resources, and answer any questions about the program and get folks enrolled. So we are Impact Assessment, and that's my contact info, but actually don't contact me because I'll be leaving on maternity leave any minute now. So I'll put the information there's Adriana's information, and then my colleagues' information for any outreach events. So thank you all so much. Thanks for having us.
Yeah, perfect. Thank you so much, Jenica. Thank you, Janet. Thank you, Beatriz. Do we have any questions about the lead-free Homes LA program? And it sounds like, you know, there's a lot of great information out there. There's really detailed and thorough support to apply. So if we'll make sure that we send out a copy of this slide deck to all of our participants today, and it will also be posted on our website. So if you want to refer someone later to the program, please feel free to kind of connect with us, and we'll make sure that that we can make sure that they are connected. Juliana has a question.
Hi, Heather. No, we have a lot of questions in the chat.
Thank you.
Yeah, so I want to go over some of them. So Juana is asking, I think it's a question, Juana, if this includes the apartments, in HACLA.
Yes, we have a community resident who is a resident of Ramona Gardens, and so she was wondering, I think, with the HACLA properties, the Housing Authority of the City of Los Angeles, if those are included in this. We also have another question about property owners of apartment buildings contacting this program, or if there's a different program for them. So if you'd like to respond to those.
Sure. If anyone's interested to find out, like with their address, like would I be eligible to apply? Is my address in the service area? You simply go to the website, and the first thing it's going to ask you when you go to apply is for your address. When you put your address in, it will tell you and allow you through to put in an application if you're in the area. Otherwise, it will let you know that you're not in our focus area, and then you should apply with the city's program.
And it looks like based upon the application process, you can apply through this same site, whether you're a tenant or a homeowner. So it would be for multifamily dwellings as well?
Well, it's for single family residents but a tenant or a owner can live in the home. If it's more than 2 units, then you would need to go through the city for their program.
Got it. Okay.
We have another question from Monica in the chat. She's asking if there are the rules in place to make sure landlords do not try to increase rents to tenants due to the improvements in the units. And to add to this question, Pamela is asking how will residents who need to be relocated for these remediation programs be able to ensure that they are not illegally evicted in the process? What's the relocation process?
Okay, there's a couple of questions there. So I think I'll take the first one, which was about the rent increase, if I'm correct. Our owners sign a owner participation agreement, and they agree to not raise the rent more than the 3% of the consumer price index. As far as relocation and displacement or eviction thereafter, that's also just a benefit to the family, and the owner is advised that it should not displace any of our participants from the program.
Thank you. We have 2 more questions. So Pamela is asking, is there a way to highly encourage landlords to apply to remediate their buildings? She's worried about people who won't apply because they are unsure if they can in their rentals.
So I want to clarify, is the question that are owners being informed of the program?
I think she's asking if there is an outreach process to encourage landlords specifically.
Yes, for our program, our mailers are being sent to the address that's in our focus area. So if a tenant receives the information, they are able to contact their landlord and let their landlord know that they want to participate in the program, because it does require consent from the owner and the tenant. So the landlord needs to be informed. As far as if we have information on the owners, then we are able to send them information as well.
Thank Thank you. And our last question is from Rosanna. She's asking if this program also includes contaminated soil.
It does. They inspect the drip lines of the area, which is on the exterior portion of the home, and note that if there are hazards in the soil and around that area.
Can I make one additional comment about just relocation during the work? I didn't hear Beatrice say it. I'm sorry if I missed it, but we do relocate families while we're doing the work at no cost to the family. So that we'll put them in a hotel of their choice. We'll even board their pets. We really want to try to make this process as as simple and as least intrusive as possible. But we know that this is a lot to ask families, to let us into their homes to do this work. So we really try to work very closely with them and, meet the needs of those families.
Thank you all so much. I think we are at the end of our time for this particular segment today. There are a couple additional questions in the chat. So if one of you, Janet, Beatrice, or Jenica, would like to kind of pivot into the chat, you might find some of those questions and be able to respond to them in writing. We do publish a copy of the chat after the fact, so people can see the Q&A responses for their information later. So thank you all. Thank you three for joining us today. Obviously a really important program, and it's lovely that the focus right now is on Boyle Heights. We will definitely do all we can to help ensure we get the word out to our community residents so they can take advantage of this program. All right, with that, I am delighted to welcome our colleagues from Metrolink to join us and talk a little bit about some of the Metro programs. Hang on a quick second. I think this is correct. Yes, I think we're going to invite, I think it's Dan will be inviting to kick us off with a conversation about the new Metrolink station, the San Bernardino line feasibility study.
Good morning. I'm super excited to be here today, and thank you for giving me the opportunity to make this exciting presentation. It's very nice to hear everybody talking about so many things. And this is just a general picture. As you can see, is a feasibility study on San Bernardino line. This is overall project view located at south of USC Medical Center Station. We are currently in our feasibility phase, and we are starting to evaluate whether this could meet the needs of the increasing travel demand to the medical center. And next. Okay. I thought that we talk about the purpose and need. We are currently exploring the feasibility of increasing mobility of the public transit area through this view. Metrolink commuter rail station, as you know, USC Medical Center employs over 9,600 visitors. Currently, they're served by major Metro J line. So there are other opportunities to increase the mobility and add this additional multimodal station to the community. As you can see, there is already 600-bed public teaching hospital. LAC USC is one of the busiest public hospitals in the Western US. And with almost 39,000 inpatient discharge and 1 million ambulatory care patient visits every year. So it's going to be very, very busy. So next. I thought that I talk about the first and last mile improvement connection. These are the photos that we took from the existing sidewalk, and our feasibility study will look at improving some of the existing ADA accessible options, will improve the infrastructure for the bikes and pedestrians, adding more signage for patrons. And our study will show, our feasibility study will show that we're gonna do a lot of improvements to make it much look better. Go ahead on the fourth. Okay, so this is the map of showing the dash line and other buses. There is currently metro bus service servicing Marengo Street, Zonal Avenue, and Mission Road. LADOT is servicing Mission Road, and Metro is servicing Valley Boulevard, and El Monte Busway is Metro Red Line, Metro J Line, and Transit Silver Line Streak is in that other side. And there are more than 10 bus stops around the USC Health Science campus. And there is photos that we can, the dash line, El Sereno bus line, there will be improvement to the local bus circulation shown in the blue, in that area, at the blue. And that actually comes down closer to our station side. There is additional Valley Boulevard improvement, including additional bike lane, as it's shown here. So these are the improvements for the mobility. Next, please. Okay, this is just the existing general location to the side. You can see existing pedestrian bridge and the State Street bridge to the north. This is just the overview of the general location. Hospital parking garage is right across from the tracks. And next, please. Okay, so this is still you can see the pedestrian bridge connecting the existing bus station. Patients come in and go through this tunnel, and they get off and come to the campus. By us putting the station in this area will help quite a bit. And as you can see, this is Pomeroy Avenue and State Street Bridge. There is a lot of this area in green, it's a lot of encampments, and we're going to improve all of this area. Our study will show. And please, next. This is just a site plan of our proposed station at this site. As you can see, is going to be 600 foot length platform, and there is a bridge, pedestrian bridge, and 2 elevators. And there has been talk to possibility to connect from here to State Street Bridge. We are currently working and coordinating with LA County people, and we're going to have big improvements in this area. Next, please. Okay, this is a photo that shows Pomeroy and Kingston, and LA Metro has a lot of land in this area. It means that our right-of-way includes a lot of area in this location, so we can easily put a kiosk or cafe or a mini mart in this area right after people get off the station. So it makes it much more friendly and safe. And there's going to be also that bus that's going to go around taking people and show everything. So next. Okay, these are the examples of the pedestrian bridges that has been constructed by Metroink. As you can see, that is Corona. The first one to the right is Corona North Main, and the other one is being constructed by Metrolink Fullerton. And also you can see the pedestrian bridge in Riverside and West Corona. And we definitely are open to take your feedback, which one you like, or if you want to add anything else, we are open to that. So we want to make sure that you all like what we show, what we're going to construct, and what we're going to plan for that. Next. If you have any questions, please feel free to call me or any other person.
Thank you. There is one question in the chat about the dash bus lines.
Yes.
There's a comment that there's only one dash route from City Terrace that goes to the medical center. Is it possible to get other dash lines to swing by the area from El Sereno or from Lincoln Heights?
Yes, we will have a big meeting with our stakeholders, and we will bring that up. And if we can see possibility, that's going to happen for sure.
We have another question about several bus routes that are very necessary for the community were removed, specifically in Soto and Evergreen, since there is not, and therefore there's not much access from Ramona Gardens. Is there some conversation about either replacing or finding new alternatives for accessing those spaces like Ramona Gardens that have been kind of disconnected because of the removal of those bus lines?
Robert, can you take that?
Sure. I would just say that our feasibility study certainly looks at the interactions between the community and how the community is served by transit. I couldn't speak specifically to that bus line, but I do know it's a coordinated effort with the local infrastructure, what that looks like today and what that could look like in the future, and how the addition of this station will work with the existing transit infrastructure.
All right, thank you. Thank you, gentlemen. We're going to move on to our next presentation, but keep the questions coming. I'm delighted to welcome Jeanette Flores, and she's being joined by her colleague, and I'm afraid I've lost her name. Is it Cynthia?
Elizabeth Lynn.
Elizabeth, not even close. So sorry, Elizabeth. Jeanette and Elizabeth, welcome.
That's her nickname, Cynthia.
Great, then I got it.
Good morning, everyone. Buenos dias a todos. Thank you for this opportunity to present this morning. It really feels like I'm back at home working with Rosa Soto, with Heather Hayes, Cristina, Belinda. So these are all my comadres and great friends for years. So thank you for this great opportunity to present this morning. And I know we're a little bit short on time, so wanted to just make sure that you're all aware that I'm available. Please email me, call me. I'll put my information in the chat. We're happy to do additional presentations to community groups as well. We can also do them in Español, porque aquí somos bilingüe. So please reach out to us if we can be a future assistance or if you need additional information. Thank you very much. Next slide, please. So what is SCORE? SCORE is a Metrolink initiative. It's the Southern California Optimized Rail Expansion Program. And this vision is a $10 billion program that will improve freight and passenger rail for Southern California. And at Metrolink, we're very proud to say that we're one of the cleanest, if not the cleanest, passenger rail agency in the world. Our entire fleet of locomotives will operate on renewable fuel. So we're very excited to share that because we take our community serious. You know, we want to ensure that we are good stewards, that we're in communities and respecting communities. So we are very passionate about that as well. So I wanted to just share that with you this morning. Next slide, please. So again, this is another very important part of SCORE where we're actually making safety improvements, and Elizabeth will share a little bit more about that. Our goal is to make the rail safe, not only for our passengers, but again, for our community. So we're adding some safety enhancements as a result of SCORE and the funding that we're receiving through SCORE. We want to make sure that we have service, you know, clean and safe service. And ultimately providing access to jobs and to job centers for our communities, right? As we come back from this pandemic, we are seeing more and more folks going back into the office. We're seeing more mobility, and we want to be a part of that. We want to be a part of that transportation journey for communities. and want to do seamless connections. Again, our economic vitality is really important to Metrolink, and we want to ensure that we're supporting that. And healthier air for all. So as I mentioned, we have renewable fuels, and they'll be recycled products that are burned much cleaner, and they come from animal fat and vegetable waste. So we will be decreasing greenhouse gas emissions by 80%. So again, very, very proud of that. We are the only transportation agency, I think, in the world that's doing this right now. So all our fleets will be clean, again, ensuring that we are respecting our communities. We want healthier, cleaner air. We want folks to get out of their cars and into our trains, again, just to clean up our air. As you all know, it is pretty polluted here in Southern California. So that is really the goal that we're working toward. Next slide, please. So we see that Metrolink also moves economies. As you could see from the visual, we are creating jobs, 1.36 million jobs. This is actually a study that was developed by the LA Economic Corporation, and they found that Metrolink does also move the economy, and we contribute to jobs. We enhance economic growth and vitality from San Diego to Ventura County. So we have 62 stations, we have 538 miles of rail, and again, all a very robust opportunity to help our communities, both economically and on the environmental front. So this is just kind of a nice visual that really, again, it shares how much of a contributor we are to this economy. Next slide, please. So today we're here to talk about our Marengo Siding Extension Project, which is so close to the Wellness Center, actually right next to it. So we're excited to share this information. Again, excited to work with you all in the community. Please feel free to reach out. Again, I will put my information in the chat. I'm happy to have conversations with all of you, and I hope to see you all in person soon. Muchas gracias. I'll turn it over to Elizabeth Lund, who is our Assistant Director of Design for SCORE and for Metrolink, and a very talented female engineer with our organization. So I'm very proud of that as well as we celebrate Women's History Month. So turn it over to Elizabeth Lund.
Thanks, Jeanette. Good morning, everyone. It's good to be back. I was presenting to the group probably 2 years or 3 years ago when we were all able to meet in person. So glad to be back to share an update on this project. But let me first start with just describing some key components of the Marengo Siding Extension Project. As you see on the map there, it's located adjacent to the Fowler Street to the Marengo Street crossing area. It is within the railroad right of way, so just north of the I-10 freeway. And you can see in the illustration, we've got in gray line is the railroad corridor, and currently there's 2 tracks you can see on the left, and then 1 track towards the right. And our project is going to increase the length and extend what we call a siding track further towards the east by approximately 3,325 feet. This extension and railroad work will occur within the railroad right-of-way. With that, there are signal improvements as well that will occur at the 3 call-outs that you see where signaling is required to operate the trains. There are safety improvements at existing bridge structures at Marengo and Soto Street to protect those piers. And then we recently added an addition to the project, which is a construction of a wall along Chelsea Street. Currently, there is just an existing fence there. We were able to secure funding to really enhance that area and community there by constructing the wall. And that was communications with the city and partnering with Metro as well. And there are plans to beautify and bring a mural as well in that area. With that, just to illustrate what this does is that you can imagine a single lane roadway. And typically, if there's a single road or single lane, you're limited to how many cars can run through that roadway, or cars have to wait on one another for another car to pass. So very similarly with the train system, when we have a single track, then trains may have to wait or idle, or we are not able to run trains at certain schedules that we anticipate or on time, etc. So this allows us to run a more fluid system. Onto the next slide. And so kind of leading that on to project benefits, again, this siding extension will allow for more reliable, efficient operations and decrease idling of trains. By having a more reliable system, we hope to attract more riders as well and serve the community, hence taking cars off the freeway, but also reducing idling of trains. And then, as Jeanette mentioned, reducing emissions and just improving the air quality. The next bullet is about safety improvement. So as I've mentioned about, the structure, peer protection, I'm sorry, one slide back, peer protections that we're providing, but also, the wall and protecting the right of way to prevent trespassers from coming within an operating zone where, trains run very quickly through that corridor. And then lastly, as we heard from Dan about the LAC USC Medical Center Metrolink station, this is a precursor to that. That will help really improve the services that Metrolink can provide, providing more regular, more routine schedules where passengers can expect the train at a certain time during the hour, and that we can serve trains throughout the day, not just in the peak hours, because people, need to use the trains throughout the day, whether you're going to school or whether you're going to work. Not everyone has an 8 to 5 schedule. And so we want to be able to serve, a broader group of people. And so with that, this project bundled with the LAC USC Medical Center station really comes together to provide that need. Next slide. In terms of our project timeline, so we have completed the environmental back in January 2021 through CEQA. And then the design will be complete here in the spring of 2022. So we're working on that now. The right-of-way acquisition process, we are not, purchasing property or anything. It's mainly access so that we can get to our construction site or get into the railroad property. So easements, whatnot, those have to be acquired by the end of this year. And then our goal is to begin construction by fall of 2023 out to spring of 2025. So about a year and a half of construction. With that, I'll hand it back to Jeanette to talk a bit about the outreach, and then we'll take questions after that.
Thank you. So we are close to completion of the design of the project. We are in close communication with both Rosa Soto and her team, Luca Lanche with Legacy LA. So we're working with Supervisor Solis's office. And really our goal is to ensure that the community is engaged, that you're aware of the project. We won't be starting construction until 2023, but we want to ensure that we're again talking to the community, engaging the community. Because we've been remote, it's been a little bit challenging, but our goal is to definitely get out and be talking to community members about this project, since we will be constructing next year. So you have my contact information. We're happy to come back and provide an additional update as well. And we'll be doing some community pop-ups just to share more details about the project as well. So those are all coming in 2022. And we're also happy to host a roundtable or, however else we can be of assistance to inform the community of the project. So we're happy to take questions at this time. Heather?
Yeah, thank you guys so much for the presentation. Do we have any questions? I see one here in the chat. Thank you, Jeanette, for sharing your contact information so people can follow up with you directly. Another question back, the impact to Ramona Gardens with this project, will it impact the plans the community has for their natural park?
That's a wonderful question. And we have been talking to the staff at Legacy LA, we actually went out and did a site visit a few months ago, and we really are partners in this initiative. We're so excited about the nature park. It is a beautiful initiative. If you haven't seen it, please check it out on Legacy LA's website. So we're really excited to be partners. And in terms of assisting with that project, our project will help facilitate some of the pre-work. So we're hoping to be able to assist in doing some of that, preparing for kind of a berm and a larger wall that's part of this nature park initiative. So we are in communication with Legacy LA about how we can assist and really prepare our project so that it ties in nicely with their bigger picture for the nature park. So we're in close contact and communication with Legacy LA. I don't know if you want to add anything to that, Liz, in terms of the engineering work. Don't get too engineering, but share a little bit about it.
No, I think the key thing is, we want to make sure that our work does not preclude what is planned for the future, right? And that we're being very mindful and good stewards of public funds as well. So we're having that coordination. They've been able to share their plans, as Jeanette has mentioned, and we've been in discussions as well. So, but yeah, we look forward to partnering. It's adjacent to one another, and so those discussions will be ongoing.
Elizabeth, I have a question.
Yes, Dan.
Regarding the right-of-way acquisition, how many square foot of TCE you guys have? Or
You know what, I don't have that number off the top of my head, but I can certainly share with you, the parcels, etc.
So you guys are coordinating with Metro for the right-of-way acquisition?
Right. Yes.
Yes. And we can talk offline, Dan, if you want. Liz and Mike, yeah, but we're definitely talking to Metro, City of LA, Supervisor Solis's office. So we've been in communication with the key stakeholders in the area.
Because I have good experience in right-of-way acquisition, so I'll be helping you.
Great.
Thank you so much. So really appreciate the presentations today. I know that people are very interested and concerned to make sure that there is green public transportation that really connects people to the services here at the medical center. I know there were some questions in the chat about community engagement and opportunities for conversation about, like cultural arts and other kind of community opportunities for input and influence in both the project Dan was describing, as well as the one Jeanette and Elizabeth are describing. So please do, of course, come back to our table here at HICP. Please do let us know about future opportunities, public facing opportunities for the community to weigh in on these projects, and we'll be sure to promote them out to the larger community. So thank you all so much for joining us today. We have one more presentation. I'm going to ask everyone to please stay with us. We've invited our friend and colleague from the Department of Regional Planning, Ayala Scott, to give us a quick update on inclusionary housing. We know this is always a topic of incredible interest and importance to the people, to the members of our HICP table. So with that, Ayala, apologies for running so late. It happens often because we have such good discourse and conversation at our presentations. But we'd love to invite you forward to kind of share with us some updates on inclusionary housing.
Sure, happy to. Thank you for the invitation. As Heather mentioned, my name is Ayala Scott, and I'm a planner with the Department of Regional Planning. We create the land use policies for unincorporated LA County, including unincorporated East LA. So I'm here to present an update on the inclusionary housing ordinance. This ordinance was adopted by the Board of Supervisors in 2020. And the ordinance requires that developments, new housing developments of 5 or more units set aside some of those units for housing that is affordable to households of specific income levels. The income levels range from extremely low to middle income. There are different requirements for what percentage of the units in the project need to be affordable, and it's based on the location in the county, how many units are in the project, how affordable the units are, and whether the units are rental apartments, for sale condominiums, or for sale single family homes. So in order to determine how many units the projects should set aside, next slide please, for affordable housing, the county commissioned feasibility studies in 2018 and 2020. And the goal was to establish what percentage of units in a project could be rented or sold for less than market rate while still being financially feasible for developers to move forward. The studies looked at various factors, including trends in market rate development activity, as well as rents and sales prices, to see what percentage of affordable units would be feasible for the different housing types. So since the unincorporated county covers a huge geographic area, the studies broke up the county into 6 different submarkets, including East LA Gateway. And if you'll go to the next slide, you'll see a more close-up view of the East LA Gateway submarket area. This map was created before the redistricting, so the district lines may not be correct, but you'll see that the East LA Gateway submarket area includes East LA, but also unincorporated Whittier, Hacienda Heights, Roland Heights, and other communities as well. Next slide, please. So the 2020 study found that affordability requirements for new market rate rental projects were not financially feasible in East LA Gateway, South LA, or the Antelope Valley. Therefore, the inclusionary ordinance does not apply to rental projects in those areas. But condominium and single family development in East LA Gateway still have to provide affordable set-asides. Next slide, please. So in approving the inclusionary housing ordinance, the Board of Supervisors directed that an update to the feasibility study be initiated after 1 year to see whether rental inclusionary requirements could be feasible for East LA Gateway, South LA, and the Antelope Valley, as well as inclusionary requirements for condominiums in South LA and the Antelope Valley. So that study update has been initiated, and the first step was to look at the market conditions to see whether those factors that I mentioned earlier, such as rents and sales prices and construction costs and trends in applications for new market rate multifamily projects had changed substantially since the last study was done in 2020. So the answer is yes, there have been increases in rents and sales prices, and they now exceed pre-pandemic levels. There have also been increases in applications for new market rate projects of 5 or more units. On the other hand, construction costs have also increased due to shortages of labor and supply chain issues. So because of all these changes in the conditions that affect the feasibility of inclusionary housing, the recommendation is to move forward with a comprehensive update to the feasibility study. The market conditions update that I was just describing is posted on our website at the link that's shown here. So the full feasibility study update, next slide, please. So the full feasibility study update will look at all unincorporated areas and consider a lot of additional factors, such as operating expenses, vacancy rates, how long it takes to sell or lease units, and the cost of obtaining loans. The study will look at the existing submarket boundaries and see if they need to be adjusted, as well as consider additional issues specified by the board, such as requiring comparability between affordable and market rate units in terms of square footage and number of bathrooms, whether the ordinance could also apply to substantial renovations, not just new construction, mechanisms to reduce the likelihood of offsite construction of affordable units, and requirements to achieve deeper affordability for both rental and homeownership projects. So I also wanted to highlight a separate effort on the inclusionary front that is not tied to the feasibility study that I've been talking about, but is actually required by state law. So if you'll look at the next slide. So this has to do with the housing element update. So this is a state mandated document that the county has to update every few years to demonstrate that there is enough land in the unincorporated areas to meet our need for housing at all income levels. And the housing element must show that there is enough land in the unincorporated areas that would allow enough housing units under land use and zoning regulations to meet those housing needs. And since the county does not have enough sites to meet its current housing needs under existing land use and zoning regulations, the county is required to rezone to allow more units. Some of this rezoning will take place in East LA through the Metro Area Plan. And so under state law with regards to the housing element, certain sites that we show in the housing element as having the capacity for housing that is affordable to very low and lower income households will have to require 20% of the units to be affordable to lower income households. And that is regardless of what the inclusionary housing feasibility feasibility study finds. So in terms of next steps, the market conditions update that's posted on our website will be included in a report back to the Board of Supervisors no later than April 5th. And the report back will also include more items that the board requested, including market rate multifamily development activity in the East LA Gateway, South LA, and Antelope Valley areas, as well as information about substantial renovations to multifamily projects. The full inclusionary feasibility study update will be completed by the end of this year, and the ordinance will be updated by June of 2023. So that concludes my presentation. So I'm available for questions. Oh, actually, yes, I wanted to show my contact info there as well.
Great, perfect. Thank you so much, Ayala. We always appreciate you coming back and giving us these updates, kind of keeping the group really informed on what's happening next. We have a question here from Pamela in the chat asking, it is telling that rents went up and multifamily permits went up. Makes me think that many violations of the county tenant protections happened in the last years. I guess that's more of an observation than a question. We also have a question here about getting a copy of the feasibility study for East LA.
Sure. So the feasibility study itself hasn't been done yet, but basically what's been done at this point is kind of that the first glance at the market conditions. So like looking at rent data, sale price data, construction cost data, and application activity for new market rate multifamily. So that is posted on our website, but I'm happy to also share the PDF with Heather for distribution to the group.
Great, thank you, Ayala. That would be terrific.
Would
Do we have? Oh, we have a hand.
Is the old one on your website? You went pretty quickly past that slide.
Yeah, it's at the same site. Should be, yeah. So
there?
planning,
Okay.
yeah. So the if you go to that site, it should be, you should be able to click through to the 2020 like the 2020 materials. So if it's not right at that link, you click through and it should take you there.
And we have a hand raised from Greg. Greg, you want to ask our closing question for our meeting today?
Yeah, hopefully it's quick. But yeah, and first I just want to say thank you. You and your colleagues have presented several times to this group, and we always really appreciate the information and the engagement. So really appreciate you putting this together. I guess the one question I had is the market update study. It seemed to acknowledge that there had been an uptick in applications for market rate projects. Do you have any more information about that? Like roughly how many projects or how many units have applications been submitted for?
Yeah. It's actually, there's a table in the report itself that I think shows, it talks about like the different years. So like pre-pandemic 2020 and 2021. So it shows the number, and then I think it has like an average number of units in there. And then also actually as an attachment that we'll be providing, basically we took the data that we have to report to the state every year as part of the Housing Element Annual Progress Report. We basically took that, like a subset of that data. And so that's already posted, and then we just grabbed like a subset of that. So that's already on our website, but we'll be providing a concise table as part of the report back that I mentioned to the board, which should be happening in the next few weeks.
Great, and I see the table, now that you mentioned it, I see the table now. Okay, thank you.
All right, well, with that, I believe we have come to the end of our time together today. Ayala's information is up on the website. It'll also be in the materials we send out to everyone. So if you have follow-on questions, please don't hesitate to reach out and ask. And of course, you can visit the website for more materials. I do want to close today's meeting with an invitation to everyone on this call and everyone like within the network to please come join us at our Wellness Center 8th Anniversary Day, which will be celebrated on Saturday, March 12th from 11 a.m. to 2 p.m. It's a drop-in event where you can enjoy music, a health fair, some prizes and giveaways, and just a lot of exciting activities. It should be fun. Come out together. We haven't been together in a long, long time, so we're super excited to bring people together to celebrate in person. And of course, you can get a bird's eye view of some of the sites that are under consideration as part of the General Hospital and West Campus feasibility study. So we certainly hope to see you there, and we really wish you well for the rest of the month of March, and we'll be back here on April 1st, same time, same channel. We will be inviting back Doug Cohen to give us additional information on the General Hospital and West Campus feasibility study RFP process. And per conversations in the chat, I think we'll also be trying to bring some additional kind of housing conversation and dialogue to this table as well. If you have recommendations for future speakers and topics you'd like to see covered at the Health Innovation Community Partnership, please feel free to put those in the chat, or you can always email me, heather@twcla.org. With that, thank you again to all of our incredible presenters today. We appreciate your time and your expertise, and we look forward to seeing you very soon.